And of course, by this time, you should know that whenever you see me on your screen, it is time to talk about your health. A very good evening to you, and thank you for joining me on another very informative edition of Gyna Plus right here on Happy TV. This is where we talk about health issues that affect women and girls in the society. And this program comes up every Wednesday at 6 p.m. and a repeat broadcast on Saturday at 8 p.m. My name is Doris Mayoshishe. And yes, of course, today, like every other day, we're going to talk about something that is very, very important. Emphasis on very, very. Now, not to say that other things are never important. You must have heard of the word cervical cancer. How much do you know about it? What information do you have around it? What myths have you heard about it? Well, today, my guest will be giving us all of that information. All you need to do is just sit tight. We'll be right back. And right after that, you'll meet my guest. Please stay tuned. Welcome back. If you just joined us, you're watching Gyna Plus right here on Happy TV. This is one program that gives you information that relates to women's health. And this program comes up every Wednesday at 6 p.m. There is always a repeat broadcast on Saturday at 8 p.m. And yes, of course, if you miss out on any special edition, you can head on straight to our YouTube channel so you can catch up on all of the interesting episodes. Now, today, I had mentioned a while ago that we'll be talking about cervical cancer. And according to the World Health Organization, cervical cancer ranks as the second most frequent cancer among women in Nigeria, and also the frequent cancer that among women 15 to 44 years. This is quite scary if you ask me. But then again, do you know much about this, the mode of transmission, how all of this works, and how it affects your health as a woman? Well, to join me and in talking about this and would also put us on the right path and knowing what to do afterward is a very beautiful doctor who has been here before. Yes, I'm talking about Dr. Nneka Osige. She is a specialist in obstetric and gynecology from the Federal Teaching Hospital Owerri. Dr. Nneka, once again, it's good to have you. I know you came here sometime last year, and I'm happy to see you coming back here again.
Thank you, Doris. I'm so pleased to be here again.
Welcome. And as always, you're always looking beautiful.
Thank you.
Beautiful colors. Everything looks so good on you. Welcome.
Thank you.
So the big question, cervical cancer.
Yeah.
I know sometimes we don't want to talk. When it comes to health issues, it looks like it's boring. Nobody wants to really delve into all of that. But then again, talk to us about just a brief background to what it means when we hear the word cervical cancer. What is that thing that comes to mind? What's the meaning?
Okay, just like you rightly said, cervical cancer is the second most frequent cancer affecting women of the reproductive age group, and it's just second to breast cancer. And it's as well the second most common deaths, cancer deaths affecting women as well. So cervical cancer is just the abnormal growth of cells in the cervix that causes severe damage to the cervix and the surrounding tissues. So it's really dear to us because we've seen a lot of people die from it at the age of 35, 42, so it's a big deal for us. And it affects, actually, the median age for diagnosis is 50 years. But, people say it's bimodal. Why they say it's bimodal? Because you can see some peak age groups at 35 to 44. You can also see it beyond 65 and above. So that's why it's really a great issue for us. And it's also noteworthy to know that cervical cancer is now known as a sexually transmitted disease.
Okay.
So that is why it's a good one. In terms of prevention, you can prevent it as much as possible. And another good thing that favors cervical cancer is that you have what we call the precancerous lesions. So there are some cases, if you're going on screening, you can see precancerous lesions and you can treat them even before the cervical cancer.
Now, I mean, you mentioned quite a number of things.
Okay, sorry about that.
Precancerous lesions. Yeah. So that means you don't necessarily have cervical cancer and it can go.
Yes.
But then again, let me take you back to where you said it's now an STI, that's sexually transmitted disease. So put us through the causes. At what point do you even realize that this is a problem? When are you supposed to see a doctor? Or as a young girl growing up, for instance, I mean, I'm a young woman, but for younger people, for instance, who are probably between 15, say 20 or 25, at what point are they supposed to just walk into a hospital, tell a doctor, I need to, screen for this? No, put us through the causes and maybe symptoms to look at for, maybe modalities to follow, so to speak.
Okay, well, let's start with the symptoms and signs. Well, okay, let me start with the causes
Okay.
actually, because what causes it, like I said, is a sexually transmitted disease. What causes is what we call the human papilloma virus, HPV virus. Yeah, the HPV. So, in 99.7 of percent of cases of cervical cancer is caused by this human papilloma virus. So now what happens is that the signs and symptoms, in some cases, for example, when you have the HPV infection, you may not come down with any signs or symptoms. So it's asymptomatic, that's what we say. But in cases where you now have the cervical cancer, you may have things like watery, offensive vaginal discharge. You may also have bleeding that may follow sex. You may also have bleeding like in between your menses that could occur. Then for women that are postmenopausal, they may also have bleeding. Now, the cervical cancer, depending on the stage, you may also have other symptoms. Like, for example, if there's a spread to the anus, spread to the urinary bladder, you may have bleeding from there, you may have pains.
Could this be at the severe stage or?
Yes,
Okay.
obviously, that's the late stage. You may even also have back pain, you know. So these are the severe stages of the cervical cancer. So there's another question we asked, I forgot.
Yes, young women, for example, who probably might be watching
Okay,
this program.
screening. You're talking
Yes,
about screening.
yes. At what
Yeah.
point do I just sit and relax? You talk about H. You say it's caused by HPV virus,
Yeah,
and
yeah.
I do understand that subsequently we'll talk about vaccine and all of that. But what would necessitate one to even make a move? Why is that important, really?
Yeah, that's a screening. Yeah. So screening is very, very important and it cannot be overemphasized because it's actually when you go for screening, that is where we can detect these precancerous and cancer lesions early. So the screening that one could do, we have the pap smear, then you have the HPV DNA testing, and you have the co-testing.
So it's for ages?
No, not for all ages. Yeah. So for in the US, they do 21 to 60. But in Nigeria here, we do 25 to 60 to 65, depending. Okay. So now, if you're using the pap smear or the cervical cytology, that one is done every 3 yearly. It's done 3 yearly. So if you go and you're negative, they tell you to come back next 3 years. But if you're using the HPV DNA testing, that is done every 5 years. Mm-hmm. So this one actually detects the exact HPV DNA involved. So if you're screened and it's negative, we tell you come back in the next 5 years. So you keep doing it 5 yearly until you get to that age group of 60 to 65, depending.
Okay, maybe when we start talking about the vaccine, I'll bring up a question, but let me put it on hold on for now.
That's okay.
Now, are there risk factors that predisposes one? You said while I was doing a bit of research, I read stuff that would relate to alcohol intake, smoking.
Okay, yeah.
Talk to us about this from a medical standpoint. What is that thing why would someone just come down with, I mean, I know you've mentioned it's caused by HPV virus, but then again, if someone who is not, sexually active, so to speak, is there a possibility that I might come down with cervical cancer?
Okay, yeah. There are possibilities that, just let's talk about the risk factors. There's the risk factors, the race, being a black, it's a risk factor. Now, why is black a risk factor? Because, blacks are associated with low socioeconomic status. So that's why. Then low socioeconomic status is also part of it. Increasing age, the age. Then multiple pregnancies. Women that keep delivering is part of it. Then just like you said, tobacco smoking, it's not too clear, but it's been shown that it actually makes the HPV infection persist. And when there's persistence of this HPV infection, then cervical cancer ensues. Then high-risk male, what we call high-risk male is whereby a woman, she's in a monogamous setting, she has just one man sleeping with one man, but the man himself is sleeping with different women. So that's what we call high-risk male. Multiple sexual partners from the lady is also a risk factor too.
Okay. Yes, before we go on a break, I will just drop this question that younger girls who intend to get involved in early sexual activities are prone to coming down with cervical cancer in their older ages.
Yes.
This is true?
Yes, that's true. The early sexual debut, it's part of the risk factor.
So whether or not, make it make sense to us, because I don't want to start assuming things. Was it also the HPV that causes this, even if the person is not?
Yes. No, what it's telling you is this, is what we call early coitus. So like early sexual debut, Like when a woman is exposed to having sex before the age of 20 years. Do you understand? Yeah. So for the ladies that have sex before the age of 20 years, they're at risk of having this HPV infection. Because ideally within 6 months to 3 months, this HPV infection should clear from the system. But you can imagine you having the sex before 20 years and it keeps persisting and persisting. So you have a longer, years for it to clear. Unlike someone that has had sex in 30s or 35 years. So within some time, you can clear it up. Because, there's what we call the outcome of the HPV infection, things that could occur when someone has HPV infection. It could progress, it could regress, and it could persist. So for regression, it's cleared. Then for persistence, it may be there for some years, and that is where the early coital people come in. Then for progression, can progress into having cervical cancer. There's a precancerous lesions and eventually cervical cancer.
Yeah, of course. I do have more questions on this particular one, but I guess where we have to go on a break. If you just joined the program, this is Gynepost, and we're talking about cervical cancer, how young girls or the women can actually learn more so they can keep safe. And of course, Dr. Neka, trust me, is doing such a wonderful job. But at this point, we're going to short break. We do have more coming up. Please stay tuned. Welcome back. If you just joined us, you're still watching Gyneplot right here on Afi Television. This is where we talk about health issues that affect women and girls in the society. And my name is Doris Mayam Shishe. And I still have my very beautiful Dr. Nick Alsigwe here. And we've talked about quite a lot, doctor. And the last before we went on the break was the fact that early sexual debut predisposes young girls too. Now, there's another concern that of course, while researching, I came to realize that some young girls would tell you because they don't want to get involved in any sexual intercourse. Keyword on intercourse.
Okay.
Now they now want to go oral.
Yeah.
Does this predispose them? Does it make it any better from not coming down with that's the word.
No, it doesn't. Because when you talk about the mode of transmission, it's not just all about having vaginal sexual intercourse, even oral, anal as well. Yes. Then the skin to skin contact of the genital areas. So you can imagine some people, they'll say, okay, they don't want to have vaginal sex, but you see them, having what we call the interfemoris, sexual intercourse, maybe, you know what I mean. And also sharing of sex toys predispose them to come down with the HPV infection. Yes. So it also may interest you that HPV infection is not only the cause, it's not only the cause for cervical cancer, it also is being implicated in anal cancer, vaginal cancer, yes, vulvar cancer, even rectal cancer, yeah.
Now I like
oral pharyngeal, because you talked about oral sex, and even oral pharyngeal cancer, yes. HPV infection has been implicated. So
now I know that we talked about some of the risk factors. I know you mentioned the fact that all of this could be responsible for this. But at what point now I know I asked this question before, but I feel like you should stress more on it.
Okay.
At what point should someone just see a doctor? Aside the fact that you want to go for a screening, what are these visible signs? I know you mentioned the fact that bleeding for younger persons, now more specific on younger people.
Yes.
What are these signs that would necessitate me now to take a stroll to the hospital and say, this is what I feel that might actually be
aside the screening?
Yes, aside the screening.
Yeah. So what we usually see in the clinics are people that come down with, they'll tell you they have watery and offensive vaginal discharge. They'll tell you that they had this bleeding following sex for the younger ones. Do you understand? Or they may tell you that they have bleeding from the anus or bleeding while urinating. So in that case, you must have spread. Then they may also tell you about back pain. These are things that they may tell you, or they may even tell about chronic pelvic pain. So you may think it's some other thing. It's when you now check, do a vaginal examination and all that, then you now say, okay, maybe this. Let's go up, do a cervical screening. Depending on what you see, because there are some cases that you see will cause suspicious cervix. There's no need doing screening in that case. So you go ahead to do colposcopy and biopsy. Just take a biopsy and subject it for pathological diagnosis. Yeah. So once it confirms that, you can go ahead with the treatment.
Okay.
Depending on the stage.
Now, good enough that you brought this up, right? I was reading up a story, It was quite touching for me. Not like I know this person in person,
Yeah.
but she mentioned she was between 25 and 27.
Okay.
And she mentioned the fact that while she was making out with her, her lover, she started bleeding at a point, and then
Okay.
she started itching. She felt it was just normal, infections. That's how she called
Yeah.
it. And she just did not pay attention to it until it got so bad that the bleeding became really worse. And
Yeah.
then she went to the hospital, and then they saw the precancerous growth, the lesions there, and they told her, according to her, the doctor was not even nice to her. The way the information was presented was it further broke her, and she came down with depression. And
Okay.
although the family supported her and all of that, now the reason I'm bringing up this story is you are in the hospital setting. How real are these things? Have you ever had a patient who went down with cervical cancer? What's the experience like? And do they ever get out of it? Like, is there some sort of treatment that would help the person come back to a normal life? I mean, I have lots of questions in my head, but let's just start
Yeah.
with this one.
Okay, and Doris, it will interest you that every year 12,000 women come down with cervical cancer. And amongst these 12,000 women, 8,000 women die from cervical cancer annually. So, yes, so it's
This
that
is not the
common.
global statistics.
No, 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 no. No, no, no. Okay, what do you mean? Okay, like
Is
everywhere.
this in Nigeria? Is this for just Nigeria, or it's just something that happens around the world? I mean,
No.
the statistics you bring.
These statistics I'm telling you is globally.
Okay.
Yeah. So this is what we see. So we see a lot of cases like that. Like for instance, 6 weeks ago, a 42-year-old lady died from complications of cervical cancer. 6 months ago, a 35-year-old lady died from cervical cancer. So it's real. We see it. We see it. And that's why the key thing now is let's try as much as possible to prevent this. And that is why the WHO also brought out what we call the 90-70-90 strategy, WHO global strategy for elimination of the cervical cancer. So it's really a real thing, and we're trying as much as possible to curb this disease.
So, if we want to talk about the treatment, for instance,
Yeah.
would you say it's something that is easy in terms of finance, in terms of care, in terms of medications? What is it like in practical sense of it?
Okay, well, cancer is not cheap anyway. Treatment of cancer is really, really expensive. And the funny thing that happens in Africa and in Nigeria is that most of them present late. So we have a stage 1, stage 2, stage 3, stage 4, stage. So from 2B is a late stage.
Oh.
So most times when we see them, it's already late. So that's
when it's late, what do you now do? What are the procedures from that point? Is it a chemo? Is it
okay? Yeah. A lot of things are involved. In terms of treatment, you have surgery, chemotherapy, radiotherapy. So there's something we also call chemoradiation. There's the combination of chemotherapy and radiotherapy, right? So for the late stage, usually we tell them, let's do chemoradiation. So the combination of the chemotherapy and radiotherapy. While in the early stage, we could do surgery and it can be followed up with chemotherapy, plus or minus chemotherapy. So it depends on the stage. So that is why we usually say that the best form of
prevention. Let's talk about prevention holistically.
Yeah.
I like the fact that you've already outlined the causes, you've outlined the risk factors. So
Yeah.
people already know that this is what might make me have this. But then again, what approaches do you think younger people or maybe women who are in their reproductive ages can put in place to prevent coming down with cervical cancer?
Okay, well, the first thing is health education, just like what we're doing. I mean, we're on air now trying to educate the public. So we need to, first of all, educate parents, guardians, boys and girls on it. Then as much as possible, we also tell these young ones to delay their sexual debut as much as possible. If possible, to abstain from sex. Like I earlier told you, that cervical cancer is actually a sexually transmitted infection. Currently, that's how we grade it. Then another thing is for those who are already sexually active to use barrier methods like condom, right? Then again, talk about government policies, to help with this HPV vaccination. I thank God that we've started the rollout. The rollout was done starting from last year, October 25th. We had another one May 27th in the other states. So HPV vaccination will also go a very long way to help. Like I told you, HPV infection has been, implicated in 99.7% of cases, with regards to cervical cancer. Then going forward, early detection and treatment. And that's where we talk about the screening. We've talked about the screening. Then another thing is when they come down with the cervical cancer, less as much as possible to treat it. When we're talking about the cancer medications, the chemotherapy, the radiotherapy, they're all expensive. So if the government can try as much as possible to subsidize this for people that have this, it will go a long way in preventing and treating them.
Yeah. So for the purpose of this conversation now, I know a lot of persons who want to ask, maybe they probably are feeling a certain kind of way, but this is not a medium to advertise anything. Are there some sort of government hospital where people could just work here, carry the test? Is it very expensive for younger women who want to check or maybe screen? Is there a way they can go about it? Because I know when it comes to health issues, we tend to hold back a little bit. I don't want age to know that I'm going through. With some sort of itching around your vagina or your private area, you don't want anybody to know. You just want to hide it. I think that's part of the issues why we are where we are as a people. But then again, is there some sort of center in the East or in Enugu where people could get all of this information or seek some sort of counsel on how they can go about living their lives?
Okay, well, both government hospitals and private hospitals can offer that.
So you can just walk in?
Yes, in terms of the screening. But remember that health is not cheap at all.
Okay. So you could just stroll in and say, okay, I want this, and then they attend to you.
They'll give them the pre-counseling test, and subsequently do the screening test for them.
All right. Now, we are not done yet. We will definitely come back, but I do have more coming up. And this discussion is not going to be a one-off because we've not even talked about the vaccines. I know this is a critical part of this conversation, but at this point, we'll take a break. And right after that, we'll try to wrap up and then bring you more from next week. Please stay tuned. Thank you for staying tuned. You're still watching Ghana Plus Radio and Television. This is where we talk about health issues that affect women and girls in society. And this program comes up every Wednesday at 6 p.m. There's always a repeat broadcast on Saturday at 8 p.m. My name is Doris Mayim Shisha, and of course I still have my very beautiful Dr. Nneka Osigwe here. And Doctor, we've talked about quite a lot. This is like the wrap-up stage. But I mean, very quickly, something crossed my mind. Remember when I shared the story of someone that, with
late 20s.
And that was off camera. I didn't even mention it on camera. But then again, she didn't make it. She died. When all of this, her cervix was removed. So does it ever get to that point where it's removed and then you're not okay? And make it make sense, really. Because what is this thing? I just want to hear from you.
Yeah. It depends on the stage, like I earlier told you. So that's why we need to do the biopsy and take it for pathological diagnosis, and you stage it. So staging is actually both clinical and pathological, right? So it depends on the stage, like I earlier told you. So if it's an early stage, you could do surgery, and depending on what else we see clinically, it could be followed up with chemotherapy. But once it's late stage, we usually do chemoradiation, right? So there are some cases we've seen this where you've done surgery, and after surgery, the surgery actually involves you removing the cervix, yes, and the uterus. Because the cervix is actually the neck of the womb. In layman's terms, so you understand, it's actually the neck of the womb. So it's being removed. So when you remove it, sometimes, yes, they may still bleed. Because, there's something we call the cuff, the vaginal cuff, because what we'll be holding is just the vagina. So it depends on the spread, like I earlier said. So if there are metastatic lesions beyond the cervix, the cervical, the mitotic lesions or the cancer lesions are still there. So that will still occur.
Okay, I have a question. Maybe I guess I'll have to leave it for next week because we're going to continue this conversation. Thank you so much, Dr. Nneka Osigwe. Of course, we've been having a chat with Dr. Nneka Osigwe. We're talking about cervical cancer and how they affect women's health. And there's so many things that we've not talked about yet. This conversation would continue next week. But while we wait for that, remember that health is wealth. And remember, the doctor has been saying that health is very expensive. And there are key ways you can put yourself in check. And that's why she talked about the risk factors. And one way you can catch up with all of this, in case you missed it on Wednesday, is to check out on our YouTube channel. And we'll see you again next week. My name is Doris Mayim Shisha. Please have a lovely day. Bye.
Bye.